Raising spirits and raising awareness. That's what this company is all about. We have Leah Lingen with Confident Through Cancer here with us this morning to tell us about how her company makes a difference for people struggling or going through the battle of cancer. Good morning, Leah. How are you?
Good morning. I'm well, thank you.
Well, it's so wonderful to have you on here. Let's just explain to the viewers at home a little bit about what your organization is, what the goal of it is.
Yeah, so, with a cancer diagnosis, there are many appointments, many new words, many, new experiences that people go through, and there's a lot of unknowns involved, and the fear of unknown is a huge thing. So my goal is essentially to give a little bit of tidbits of information, background sort of information for patients who are being diagnosed with cancer so they aren't showing up at appointments, unaware of what to expect.
And what was your inspiration for starting this? Did you have a personal journey similar to it or see one happen?
Yeah, I actually work at Sanford Health in the nuclear medicine PET CT department. So we do probably 12 to 13 PET scans a day, which are a scan that's used to stage and restage cancer patients. So we see a lot of cancer patients every day, and you can feel the overwhelm that many patients are going through, and I wanted to help.
That's amazing. Yeah, seeing it and saying I can do something to make your life hopefully a little bit better.
Yeah.
For the people that are there, because I can't imagine it has to hit you like a brick wall.
Yes.
When they first come in and tell you about it.
Yes, and when patients are diagnosed, they go through a lot initially very quickly, which is great because you want to get treatment started right away, but it's a huge information overload, and I want to try and ease a little bit of that by giving that little bit of background information so people have an idea of what to expect some days.
Okay, that's good. And so you brought some of the stuff here that you have. I'm just going to hold it up. This is a planner. It's called the Battle Plan, a cancer journey planner. And just talk about like some of the stuff that is in it here, like on this page.
Yeah, so it is a 6-month undated planner, so it can start at any time. And it's broken down to each week has a page, and it has a patient check-in. So how are you doing today? Goals for the week, kind of a mental health check-in as to something you enjoy doing, what you're looking forward to, and then a spot to remember to write questions that you might think of that you want to ask the doctor at your next appointment.
I think that's amazing. Oh, yep, there we are. There we got the camera on it. So this is one of the things there. Looking at it, I think it's amazing how it's undated. So depending on when someone starts this fight against cancer, yes, the diagnosis, it doesn't always follow a regular calendar.
No, not at all. And it also has a couple of different things that are geared specifically towards just cancer patients. So it has an area to keep track of your medications. It has an area to write down all the contact information for all of your doctors, all of the nurses. It has a spot that you can write, notes at each appointment you go to, so that even if you have caregivers that are with you, they can keep track of what's happening and what's changing through your cancer journey, as well as you can keep track of it too.
Yeah, I was just looking here. This is the first page that has the medications, and then before that, sorry, I have to flip through it so I can see what I'm looking at. But it also has, the care team, hospital, clinic, address, medical oncologist, radiation oncologist, surgeon, dietitian, social worker. A lot of these things, information, they give you cards, they give you paper at your appointment, and what do? You shove it in a bag, or you put it somewhere and you forget where it is.
Yes, exactly. So the goal is to be able to bring, just this book to every appointment, have your nurse help you fill out when you have appointments coming up, what changes you have happening, what medications you're adding or taking out of your regimen.
Yeah, that's another confusing one too, if you're on so many medications. Well, have you been on this one before? Well, I don't know, I'm on 15 different medications and they change every other month, so it's hard to remember. And this one I also really like. Just kind of talk about what the inspiration was for this desk calendar you have here.
Yeah, so everybody that is diagnosed with cancer still has everyday life to experience. So, you still have soccer games to attend, dentist appointments to go to. It's used to integrate, everyday life with all of your cancer appointments, because there's a lot that changes real quickly. So being able to look at your week ahead kind of helps people to be able to be organized and, plan, maybe I need a ride to this, maybe I can have somebody help me with this. Just basically to ease as much as we can with this cancer journey.
And also handy if you have a family and you're going through this struggle, so other people can see it too.
Yeah.
And know that, okay, you know, today might kind of be a difficult day. They have this and this going on with their doctor.
Yep, leave it on the
today.
counter,
Yeah.
out and visible.
That is amazing. And so if people are interested in getting this for themselves, for a loved one, how do they go about doing that?
Yeah, so I have a website. It's called www.confidentthroughcancer.com, and I have an Instagram page that's Confident Through Cancer also, that has all of the, you know, inspiration, tidbits of information, that sort of thing. You can follow me.
And also, it seems you have a podcast coming up.
I do. I'm launching a podcast in March, so just getting rolling on that too. So lots of new things.
Okay, that is amazing. Well, Leah, thank you so much for coming on our show today.
Thank you. I appreciate it.
Yeah, great resource there for people. I hope at home you check it out. Ahead on today's show, Swanson Health is back. We're going to be checking in with them a little bit later as we head on through.